If a person's care needs can't be met at home, there are many options for providing a higher level of care. And what works for one person might not work for another person. So, as with all of these decisions, you need to keep the person at the heart of your decision making. But there are other considerations or important considerations which will influence your decision making, which are the person's acceptance and awareness of the situation, and also financial considerations and their current social situation. So it's normally it's normal to introduce care in an incremental way. So if someone's living at home and they don't have any care, the first step is usually to introduce a package of care, and that will involve, for dementia, usually it would involve someone coming in between 1 and 4 times a day to support the person with with meals, with maybe with shopping and housework. But as the cognitive difficulties progress, they might need help managing their medication, prompting with medication, and personal care, sort of washing and dressing. If someone has physical health care needs, so their mobility is poor and they have a dementia, it can in some cases be possible for them to have a microenvironment set up at home. So they're sort of essentially living in one room, and in that case they might need to have a double-handed package of care, so have 2 carers coming in at a time. But as dementia progresses, if someone's care needs are such that it's not really safe for them to be left alone for any significant amount of time, then you're looking at needing a much more supported care environment, depending on the person's financial situation, because there would need to be self-funding for this. There is, in some cases, the option of having a live-in carer at home, and that can work very well for people. It doesn't involve the distress of having to move away from a very familiar environment. But for other people, that won't work. There might not be room, or they wouldn't want someone living in their house, or actually their care needs are such that that's just not going to really sort of meet them. So in that case, there are again lots of options. So ranging from warden-controlled or sheltered housing, which is usually someone having a flat, their own flat in a building where there is a warden available, usually just during the day, and then there's also the option of having carers coming in if needed. Something called extra care sheltered housing, which is sort of a step up from sheltered housing, as the name would suggest, and there are staff on site 24 hours a day, again with people living in their own self-contained flats. Depending on the particular accommodation, there might be in-house carers who can go in, or external carers would go in to see the person. And after that, we're really sort of, the next level up would be thinking about 24-hour care, which is when someone can't be left alone for any real, length of time. So in this case, there are residential homes which offer 24-hour dementia care for people who don't have any nursing needs and don't have any complex symptoms or challenging behavioural symptoms of dementia. And then there are nursing homes which do the same, but they also have registered nurses working in them. So if people have physical health care needs, they can be met there and would be better looked after. So there's also an added layer of care that's available in residential and nursing homes. And these homes are called EMI homes, which is a very outdated term. It stands for elderly mentally infirm. But in EMI residential and nursing homes, the staff to patient ratio and composition is different because there are also mental health trained nurses or nurses trained in mental health who are able to provide specialised care to people with more complex and challenging dementia presentations. So, for example, if there's a lot of agitation or aggression or refusal of care, these are the sort of would be the most appropriate place for someone to be looked after. So I suppose what's difficult, I think, about when someone needs to move into a more supported environment is if they don't want to. Some people will be quite open to the idea and may even feel that they're lonely at home and that it would be an advantage or their preference to live in 24-hour care or in a care home. But there are many who don't feel that way and don't feel that they need it. So there are things I think that can be done to try to encourage someone. So of course, taking into account the things that are important to them, the location of the home, going to have a look at homes and choosing one that appeals to them, and perhaps even trying a period of respite care in a home to see how it feels and what the reality is. It's important to respect someone's decision about whether they stay at home or go into a care home, as long as they have retained decision-making capacity and they're able to understand the concerns and the risks and weigh up that information. But what we see as dementia progresses is that people some people lose that decision-making capacity and they're unable to understand what their care needs are or the risks that their condition might place them at. When this is the case, we can act under something called the Mental Capacity Act framework to make decisions about care for someone in their best interests. If they have a lasting power of attorney, their attorney will be able to make decisions for them, taking into account what they would have wanted, but also taking into account their current situation. And in that case, it may be that they will move into a care home, even if it's not what they feel they want at that time. I think, it's really difficult, it's very stressful for people, but what is worth sort of being aware of is that even though it can, people might feel very strongly it's not what they want, sometimes when they get there, they can really thrive in that situation and benefit from the structure of the environment and the increased social interaction that's available there. If there isn't a family member and they need a change of accommodation under the Mental Capacity Act, then they should be referred for an IMCA, who is an independent mental capacity advocate, who will represent them and their views when the decision is being made in a best interest meeting.